As Vermont schools plan to reopen, some pediatricians are calling on the state to prioritize in-person learning at the elementary level and for students with special needs. The Vermont chapter of the American Academy of Pediatrics believes the health risks of reopening need to be weighed with the developmental risks of limiting in-person classes. Local 22's Devin Bates tonight reports.
The group believes that Vermont's falling case totals, combined with data that shows some children are less likely to be infected, means this is a step that must be taken for the good of students.
We know that this early education period for brain development is so key, and that families are really supported by the schools in so many ways beyond just education, and that's the hole that's left when we think about keeping kids out of school.
Dr. Jill Reinhardt is a pediatrician and recently served as president of the American Academy of Pediatrics Vermont chapter. She understands the concern among parents and teachers about returning to class, but also believes an extended stretch of remote learning wouldn't be a viable option for elementary school students and students with special needs.
OT, physical therapy, speech and language therapy, that population is really missing out so much, so that we see our young people in Vermont having regression. So losing some of the skills that they've had up till now. The other thing I've seen kind of universally from all families is the loss of routine.
As part of their proposed hybrid schedule, the Burlington School District has floated the possibility of Fridays being an additional in-person education day for students with special needs. On Friday, Superintendent Tom Flanagan acknowledged that some students may need to be in school 5 days a week.
We're working through that and taking each student's individual plan at a time and evaluating the way that we'll be able to best support their needs. My hope is that we get back to school, school is safe, we build confidence, and then families and staff feel more comfortable coming back to school more often.
Those in favor of a full return to in-person learning for certain students also pointed to the state's experience reopening childcare in June, believing reopening education could have similar success. In Burlington, Devin Bates, Local 22 News.